In this video, we'll discuss about systemic mycosis. In this one, we want to look at Histoplamosis, Blastomycosis, Coccidiodomycosis, then Paracoccidiodomyosis. In Histoplamosis causing agent Histoplasma capsulatum. Blastomycosis causing agent Blastomyces dermatitis. Then Coccidiodomycosis causing agent Coccidiotis immitis. Then Paracoccidiodomycosis, Paracoccidiotus. These are the fungal diseases. These are the causing agent. We will discuss one by one in detail. This one is the major mycotic infection, systemic in nature. Travel through a different location of our body via bloodstream, and they take long time to cure. Most of the symptoms are pulmonary in nature, are always infect in the lungs. Most of the time causes chronic lung infection. Example, blastomycosis affect each and every part of our body. So first we want to look at Histoplasma capsulatum. It is a causing agent, Histoplasma capsulatum. Then causing disease name is called as Histoplamosis. It is a mold form in the environment, found in soil, contaminated by dropping from birds or bats. So this one found in soil. How it contaminated the soil? Droppings from birds or bats. So this one distributed in soil result in aerosolized spores, especially microconidia, which get inhaled into lungs. So it is presented in soil, microconidia form. When we inhale, it will enter to lungs. Then warm temperature in the lungs causes spores to transform into yeast. So after inhale, these spores is transformed into yeast. They get phagocytized. No actual reproduction in body. Initial symptoms similar to flu or tuberculosis. Through inhale, it will enter. The spore form is transformed into yeast form. Initial symptoms similar to flu or tuberculosis. Then dissemination via blood to lymph nodes and rest of the body. So first it will reach to lungs, then through blood it will reach to all over the body. Inflammation of chest cavity, enlargement of spleen, swollen lymph nodes can be fatal if not treated. If we do not take proper treatment, it will cause inflammation in chest cavity, enlargement of spleen, swollen lymph nodes, etc. Second, systemic infection. The disease name is called Blastomycosis, causing agent Blastomyces dermatitis. It is related to cutaneous or skin infection. First stage of Blastomycosis is cutaneous. First stage cutaneous. 70% of patient got this infection. Symptoms flu and also box-like symptoms like blister in the skin, rashes, that means macropapular rashes start to form, itching, nausea, vomiting associated things. So primary stage 70% of patient got this infection? First, initially it causes flu and box-like symptoms, blister on the skin, rashes. Okay, after that it will cause itching, nausea and vomiting. Next, second stage, it is spread into our bone. First stage, cutaneous, flu or box-like symptoms. Second, it is spread to our bone. Osteoreticular blastomycosis. 10% of individual not treated early, it is entered to bone level. So first stage not taken treatment, it will enter to bone. So this one is the secondary stage. It attack your several region of bone. It attacks several region of bone, include spine, pelvic bone, femur, that means large bone. Not only bone, also affect soft tissue, also soft tissue associated bone also, it will causes necrosis. So it is called as mycotic arthritis. So this fungus affected joints and bones. So this disease condition name is called as mycotic arthritis. Third stage, pulmonary blastomycosis. It affect lung tissue and lungs. It leads to causes lungs failure. So it affected lung tissue. Then it leads to lung failure, difficult to breathe. Symptoms also flu and tuberculosis. After that, that sputum formation, difficult to breathe, sputum color change, sputum containing blood or pus. So pus or sputum come with, pus or blood come with sputum. So people like confusion, it is tuberculosis or pulmonary blastomycosis. Then if untreated, it will causes respiratory distress syndrome or chronic obstructive pulmonary dysfunction. So third stage not taken proper treatment, it leads to respiratory distress syndrome or chronic obstructive pulmonary dysfunctions. Last one is rare mixed blastomycosis. It causes infection in different tissue, testis, genital, urinary tract and different places. Sterility of man and causes brain abscess. So it causes brain abscess. So diagnosis purpose, we are collecting blood sample, urine sample, sputum sample, then we will do culturing. Then here as we can find out this acid pass facili. That test we can use X-ray, CD scan, tissue biopsy and silver staining we can use for identification of blastomycosis. So what are the sample? Blood, urine, sputum. Then what are the identification technique, isolation purpose we are using? X-ray, CD scan, tissue biopsy and silver staining. Then treatment purpose, we are using systematic antifungal drugs like ketoconazole, fluconazole, immunotherapy along with vitamin D3 also supplemented. So here what are the things treatment purpose used for blastomycosis? Ketoconazole, fluconazole, immunotherapy, vitamin D3. It will take very long time to cure the body. So third fungal disease, Coccidiodomycosis, it also called valley fever. Causing agent Coccidiodomycosis and Coccidiodomycosis species. This disease can progress to chronic lung disease, chronic lung disease, and may even become spread to skin lining tissue of the brain. So meningitis part, skeleton and other body area. So chronic lung disease, it progresses to it affected skin, then lining tissue of brain, skeleton and other body area. 30 to 35% of people who develop symptoms have fever, cough, malaise and chills, flu-like symptoms that resolve over about 2 to 6 weeks without treatment. Suppose we didn't take treatment also, within 2 to 6 weeks this fungal disease resolve. Some may develop additional symptoms such as shortness of breath, night sweat, headache, sputum production, joint and muscle pain. So some people within 2 to 6 weeks without treatment also resolve, but some people it have developed into shortness of breath, night sweat, headache, sputum production, joint and muscle pain. Women more often than men may develop erythema nodosum. Erythema nodosum, it causes a reddish, painful, tender lump, usually on the legs, or it causes erythema multiforme, allergic reaction similar to erythema nodosum in multiple body site with rashes. This one progressive pulmonary coccidiodomycosis include above symptoms but progress to lungs volume loss, fibrosis and inflammation. It progresses to lungs volume loss, fibrosis and inflammation. Then diagnosis. Early diagnosis is difficult because symptoms may be mild, so no tests are initiated. Early diagnosis so difficult because symptoms may be mild. Then confirmative test, microscopic examination of sputum or tissue biopsy. Biopsy show the fungal endospores. Biopsy, by using biopsy we can observe that fungus endospores. What are the fungus? Coccidiodomyosis and Coccidiodomyosis. Diagnosis. Early diagnosis is difficult because symptoms may be mild. Then confirmation microscopic, here we are using sputum or tissue biopsy. Other test X-ray, MRI scan and CT scan. Then treatment purpose we are using prednisone along with the dietary modification. So treatment purpose we are using prednisone or alternative therapy such as dietary modification. So people should consult with their physician before trying to use such method. So fourth mycosis, Paracoccidiodomycosis. This one is the primary systemic fungal infection causing agent Paracoccidiodomyosis branchilensis. So Paracoccidiodomycosis is the fungal disease causing agent Paracoccidiosis branchilensis. It mainly causes infection in lungs. After that it will spread to skin, mucous membrane and other body part. Reticuloendothelial system may also affected. So mainly affected lungs, then spread to skin, mucous membrane, and other part reticuloendothelial system also affected. Then sign and symptoms it vary. In the case of it mainly affected pulmonary, so it causes cough, difficult breathing, fatigue, and chest pain. Suppose this fungus will affected mucocutaneous layer, means it causes granulomatous lesion, that means ulcer, mainly mouth and nose. In the case of visceral part, it will affected means it causes infection in liver, spleen, intestine, adrenal gland also affected. So sign and symptoms it vary from organ to organ. Pulmonary means cough, difficult to breathe, fatigue, chest pain. Mucocutaneous means ulcer. Visceral means liver, spleen, and intestine. Then pathogenesis through inhale this fungus will enter to lungs. After lungs inside alveolar macrophages. After that this conidia turn into yeast form. Okay, this conidial form is turned into that yeast form. Then only through blood hematogenous spread. After 2 weeks it will causes granulomatous. Granuloma are formed. Then diagnosis we are using microscopy here, collecting samples, sputum and pus. Then examination of tissue samples, biopsy sample collected. Then what are the tests we are using? Blood test, skin test and chest x-ray test. Then treatment purpose we are using itraconazole, ketoconazole, fluconazole. Along with then we can use that amphotericin B. That condition is severe cases only we are using. Then sulfonamide. Then what are the drugs we are using? Itraconazole, ketoconazole, fluconazole. In the case of severe means amphotericin B, then sulfonamide. So in this video we are discussing systemic mycology. 4 microorganisms: Histoplamosis, Blastomycosis, Coccidiodomycosis, Paracoccidiodomyosis. In this one, first we are discussing Histoplasma capsulatum. Then next Blastomycosis. This one. After that it having first stage, second stage and third stage. Then last one is mixed one. This one is the laboratory diagnosis, treatment. Third fungus Coccidiodomycosis, also called as valley fever. Then fourth one is Paracoccidiodomyosis. In this, what are the signs and symptoms? After that, what are the pathogenesis, diagnosis and treatment? Thanks for watching.